Good afternoon and welcome to UnitedTV. My name is Kemal Erkan. Today is April 19, 2024. Today we have a distinct honor of hosting Governor John Carney, the esteemed leader of our great state of Delaware. Governor Carney has been at the forefront of guiding Delaware through both terms and challenges, always with a steadfast commitment to the well-being and prosperity of our citizens. Throughout his tenure, Governor Carney championed initiatives aimed at driving economic growth, fostering innovations, and ensuring that Delaware remains a place where all residents have the opportunity to thrive. Today, we have a privilege of delving deeper into the issues that matters most for Delawareans. We will explore Governor's vision for the state, discuss key priorities outlined in the State of State address, and gain valuable insight into the strategies being implemented. But today's discussion is more than just the policies and initiatives. It's more about the conversation, engagement, and dialogue. So today is about coming together as the community to listen, learn, collaborate, and share pursuit of better future for Delaware. So without further ado, I'm thrilled to welcome Governor John Carney to UnitedTV. John, how are you doing?
Oh, great. Thanks for having me on today. Look forward to talking to you about some of our priorities for state government. In the last year of my term as governor, it's been quite a ride for the last 7+ years. You know, we had the pandemic. I know so many of the folks that do the work that you're involved with are part of that, and we want to thank them for their work during a very difficult time, an unprecedented time in the history of our state and our country. We really look to healthcare workers to step up to the plate, and they did an incredible job. Everybody did, really, when you think about it. Every time I have the opportunity to thank our Delaware Army and Air National Guard, I do so. Had that opportunity yesterday. Whenever we needed them, whether it was to do testing or vaccination sites, even at the end, they volunteered to get trained as CNAs and work in long-term care facilities. So it was a very difficult time, and we came out of it, like many states, very strong economically, and those are our priorities of ours, and we focused on building a strong and growing economy, and that's the core of what I'm trying to do as I leave office.
So I guess coming up with the budget and trying to get everything in order, that's a very stressful, challenging time for not just for the state, but for any of the other businesses. So from the 2024 to 2025, what are some highlights of the transition?
Yeah, I think there are really three pretty big spending priorities. One is, like every employer in our state, we've got this very difficult labor market where we have more jobs than people looking for work. And it's driven wages up, and at the state government, we have lots of vacancies, and we've had to raise salaries, teacher salaries, other public employee salaries to compete with the private sector. And so there's a big cost associated with that. We're trying to raise our beginning salary for teachers to $60,000 a year, on par with what they're doing in the state of Maryland. We need to, when those young people graduate from University of Delaware and Delaware State University, we need them to stay here in Delaware to teach in our public schools. And so there are lots of things that we've done there in the budget. The second thing that's driving spending in our budget is healthcare, both healthcare for state employees and retirees, and we cover probably over 100,000 people in Delaware. And then you have those who are Medicaid recipients, and those costs, even though it's like 50% paid for by the federal government, 50% by the state. So overall, the healthcare budget of the state is over $2 billion of a $6 billion budget. And so that's a priority as well. And then lastly, and I mentioned this briefly, and these aren't our only priorities, is funding to help improve the performance in our schools. You know, one of the things that we know, particularly in this tight labor market, is that we have to have a workforce that's prepared for the jobs that are available, and to compete with other states around us. And actually, I just returned from a trip to Ireland where we looked at and visited their biopharmaceutical sector there. It's a sector that we have presence here in Delaware, and I'd like to be able to compete with them in other countries around the world. And as it turns out, the thing that really makes the difference is the quality of the workforce and the training. And in Ireland, they have a better integration between higher education and the schools and training and the private companies than we do here in the States. So we had a lot to learn from that, and hopefully we'll be more competitive. We have invested significantly in federal research grants at the University of Delaware Star campus for biopharmaceutical manufacturing, and will continue to do so to create jobs of the future.
So I guess the public education is one of the really big part of the budget. And I actually checked the 2014 numbers. So, and in terms of the percentage of the total budget, how we are doing, and I believe the percentage did increase a lot. Like how much actually we are highlighting the education and why we need to spend more. I can see that in percentages. It used to be around like 24% when you got it.
It's well over 30% now. It depends a little bit how you count it. The priorities for us, I mentioned the teacher salaries. You're only as good as the quality of your educators in the classrooms. Of course, a good school leadership, principals and superintendents and board members is obviously important as well. But also the support. We've really ramped up financial support for schools with low-income children and English learners, a big priority to make sure that those students are ready to participate fully in the workforce. And if they don't, then there's going to be other costs on the government for what's not happening there with themselves and in their families and the communities in which those schools are located. So we've prioritized that, but it really comes down to the educators in the classroom and paying them an amount of money that is competitive in our region. And so that's what we've tried to do. But, it's not just about money. We have to get performance, and that's been a focus of ours, particularly with the school districts in the city of Wilmington, which are not performing at the level they need to be. Has to be a big priority. I mentioned our competition in the biopharmaceutical sector, and we need highly trained, highly educated workforce to do that.
So I guess having kids in school these days, in public schools, is a challenge, and for you to actually put that much emphasis on the education and increase teacher salaries and doing other investments, it's extremely important. But the challenge with these types of things, unfortunately, we won't see the results right away.
You're exactly right, Kemal. It's not going to be a benefit to my administration. And really, that's not what it's all about. I've always subscribed to the Bill Clinton philosophy, which is elections and our service is more about the people, not the politician. It's more about the future than it is the present and the past, certainly. And that's really how you need to lead, is to be doing things that are looking to the future, that are preparing, in this case, Delaware, for the future and the economy of the future, making sure that our young people are prepared to be competitive. And by the way, companies won't locate here if they think there's not a workforce that can do the highly STEM, science, technology, engineering, math related jobs that they have. I mean, that's the future. And we have to prepare our young people for that future if we're going to be successful as a state. And so it's always about what are you doing today to prepare for the future.
So that's actually really so important. Like, not everyone maybe is thinking about these things, but of course, as the governor, so you probably are now the expert. Unfortunately, your term is up. So I actually never understood that. So I think you should be allowed to do more than 2 terms.
Well, I would say to that, it takes a lot of energy to do this job. And I think, and you kind of, you get worn down by it, frankly, particularly if you have a 2 or 3 year pandemic right in the middle of it, where the stress levels are high and a lot of the decision-making responsibility fell on my shoulders and my desk. I had a great team. I had a great team, fabulous team, but ultimately at the end of the day, difficult decisions had to be made at my desk, and so that wears you down. But I've thought about what to do next, and I just am looking for still additional. I still have some juice left, looking for challenges and really to focus on some of the things that I care most about, education and education of our
I
city
think,
children.
like that's definitely like education is, especially for the state of Delaware. I always said I consider myself one of those who actually, if I was born here, that wouldn't be my choice because I wasn't born here and stayed in Delaware. So I'm a better Delawarean than those who were born here. So
Well, you'll be interesting to know. It's an interesting phenomenon, I think. I went just the other day, earlier this week, to the Department of Education, Secretary of Education Scholars Celebration Awards Night. And so we had 93 high achieving students from public high schools across our state, mostly seniors in high schools.
and I think
And these kids were unbelievable. And I can tell you that half of them at least were from immigrant families like your own, where their parents were very focused on making sure their children really applied themselves in school, of an extra focus, I think, on STEM education, and just some incredible young people that we celebrated the other night with their teachers and their parents and the schools in which they've done so well. And that's where the future is. I mean, those students are going to be the leaders in our state in years to come.
definitely, and because the way that I see with our workforce, the other things that we do in this community, not just here but anywhere else, like the crime rate related to that, development and all the other things, they're all coming down to the education at the end of the day. And unless we are ahead of the game, it's not going to happen. But I think most of the work that you have done will probably see the result of those in the next 8 to 10 years period, where we are going to probably go back and say, well, this is the outcome of all those investments from 2016 to 2024. And just from looking at the percentage of the total of the budget, it just shows that we are definitely going to see some positive improvements. And hopefully then we'll have you again on the YouTube and then we'll talk about it 10 years from now. Now, economy is another really important part. And I know you have a lot of things in your budget that's going to hopefully help the economy. Now, it's a challenging time, even for businesses, even for countries, even more like not just for the states, but like our country here, but the state, of course. Other countries, I see this as a big problem. Inflation is almost becoming like something that we have to deal day to day, which we are not used to. Can we just talk about the economy a little bit to see what you have in the budget for 2025?
Yeah, so creating an environment where businesses can be successful and create jobs. I mean, creating jobs has got to be number one priority, both from the perspective of providing young people and providing families with the kind of income they need to raise a family, to buy a home, to save for college and retirement. And so we have to be competitive with states around us and even with countries around the world. I mentioned the trip to Ireland, the competition that our companies have with them as well. And so that means really we have created what we call the Delaware Prosperity Partnership, which is truly a public-private partnership. The board consists mostly of private sector business leaders and academics and the like, as well as legislators, and myself and Rob Ward are the co-chairs. And they've been very successful in working with companies to create more jobs. We've created or worked with companies to add over 30,000 new jobs since 2017. And that considers the fact that you had a global pandemic right in the middle of that. We've had some big successes in terms of companies that have decided to move to Delaware, and we've had some, we're not going to see a lot of companies moving 1,000, 2,000 jobs here, but 50 jobs here, 100 jobs there, smaller scale manufacturing. We've had some successes, I think is the way it's going to go. So that means you got to keep on it. We are making those investments at the University of Delaware in the biopharmaceutical sector. Those will pay dividends in the future. We have money set aside for what we call a graduation lab space. This is lab space for small companies that are incubating at the STAR campus or at the experimental station. They want to grow, hire more employees. And so we've got a fund to help them find locations where they have lab space for these folks. We've invested, along with the new DuPont company, in facilities at the experimental station, which are now not just private sector, not just DuPont facilities where we incubate science-based and technology-based companies. So we're developing and cultivating that ecosystem of science and tech and the pharmaceutical sector, which we think can be strong here in Delaware, and just really thinking about it, not just putting all our eggs in one basket, try to hit a home run, but knocking out some singles and some doubles and getting companies across our state. We've got some redevelopment. We've made funds. We've learned that when you have companies looking at your state, you have to have sites that can be ready quickly so that they can move into them. So we've made some public investments in industrial parks and in small business parks up and down the state, so that we have those sites ready to go when we have a prospect that's ready to make a decision to move to Delaware. So lots of different pieces that Kurt and his team at the Prosperity Partnership have done an excellent job. And one of the best things that we did 7 years ago was to form that Delaware Prosperity Partnership, and the results speak for themselves.
Now, Rob Buccini was with us. I don't know if you had a chance to see it. He talked about his Buccini Group's investments in the city of Wilmington, and we discussed a couple of their projects and making this city more attractive for those who may want to live here, not just from one neighborhood to the other, but us being very close to other states. So it's kind of like the hub in this mid-Atlantic region. So, and I see a lot of efforts from their side. Of course, they're a private business, but also I see taking initiatives, I see a different vision there where they are actually making certain things better for Delaware. And those are always good to see. And as you know, one of our medical practices is already in downtown Wilmington now. And I was telling him that we feel now safer in downtown than 10 years ago, where I wouldn't probably open an office in downtown Wilmington in 2014. So, but today we don't have that problem. I don't know if you have seen the new office yet, but we would love to have you there. We just finished all the renovations, and it feels different. And I think there's a good future. And if it feels that way for us, I'm thinking that it would be for those other employers that you were talking about, who may want to, of course, when they come here and then do investments, they also look at the being able to hire people, if people want to live here, and all those things all together, they're tied into just like even the ranking on our education, everything is all together.
Makes a difference.
Right. And it makes a huge difference. Now, speaking of
if I could just make one point there, and that is this. I've always believed, and I think it's true, that if Delaware is going to be successful, the state of Delaware is going to be successful, then the city of Wilmington has to be successful as the business hub of the state, as well as the kind of the corporate capital, which provides so much revenue. And if the city's going to be successful, every neighborhood, every street has to be successful. You mentioned crime, and so crime and safety, public safety, gets to be a big priority. And we've work with the city and Mayor Purzycki to try to address that and crime rates are down in our state. But the private investments that the Uccini Pollen and other companies have brought to downtown Wilmington and into the neighborhoods with their participation in the housing programs has been transformative. I mean, they must have $1 billion worth of private investment in new residential properties downtown and around the downtown, and in the buildings that they've taken over with new employees. What that does is it brings people to live here, to create a greater safety in the streets, more activity, which creates safety. They bring with it tax revenue that helps pay for police officers and firefighters and community development. And it just keeps building, and we need that private investment. We do have at statewide the Downtown Development District project, which has invested in Wilmington's downtown. It's invested in the downtown in Dover, in Seaford and other towns up and down our state, and here in Wilmington. And the whole idea is to bring more critical mass, more people living downtown, which helps the rest of the city. I've lived a mile from downtown on 19th Street for almost 40 years now, and I've seen the downtown district and the city generally go through ups and downs. I think we're kind of on an upward trajectory now, and a lot of that is because of the private investment and the public investments that we've made. Significant investment in housing in our communities, particularly on the east side. The land bank, I've been touring some of the neighborhoods that they've been working on, doing a tremendous job in eliminating vacant properties and bringing vitality back to neighborhoods. And so we got to keep working on that and make our city stronger.
And I'm not going to give your address, obviously, but you live in the city, right?
Yeah, I live on 19th Street. Most people know where I live.
Well,
by Warner School.
Well, those, I mean, I know where you are, but I don't I think that helps. It's been for a long time you've been there. So
about 40 years, yeah.
So it kind of shows, if the governor lives there, then people know that this is the place to be. And the only thing that I was a little bit disappointed, not with us, but I think with the decision on the other side, it was Elon Musk when he moved the headquarters from here to Texas, I believe, right?
Yeah, so that was something. Actually, I think he made some comments that were critical of Delaware. I think it was really just the fact that he didn't get what he wanted. And actually, I think that in some ways benefits the perception of corporations to Delaware. Most corporations, large corporations, are incorporated here. That accounts for about 35% of our state budget. Without that, we'd have a sales tax, no question, or higher taxes somewhere else. And so it's very important. I appoint judges who have experience in corporate law, and so they're ready to go when they have difficult cases to litigate. They're able to get litigants in and out of court quickly, so that limits the amount of money that they have to put up for lawyers and for the litigation. So actually, I think that, it depends obviously on who you talk to, but we haven't seen yet a negative impact on that, on our incorporation business, because most people want to be incorporated in Delaware because of the expertise in our corporate bar, in our Chancery Court, and those judges, and in the processes. They don't have jury trials there. They have expert judges that oversee those cases. One guy like Elon Musk, who always wants to get his way, doesn't get his way, and he's going to say some things that maybe are critical. Some people might see that as a
it was politically driven, probably. I think he's not a fan of President Biden, at least from what I've seen so far. It may be like he took an advantage of that decision and just used that as an opportunity to move to Texas. But
well, as I travel around the country, and I have, particularly when I was in the Congress, talking to lawyers, say in California, and they would always tell me that They would never incorporate one of their businesses in California that they'd always incorporate here in Delaware for lots of very good technical reasons.
Mhm. Now, Governor Carney, we are going to go into healthcare. I know most people may know this or not, but 1/3 of your budget is healthcare related expenditures. And because we are a healthcare provider, I always feel like I can help you there. But of course, we are kind of limited with what we can do. But just want to kind of get the budget overview on healthcare, and then I have a couple follow-up questions.
Yeah, so one of the things that we've done with state government, right, is we've created what we call a spending benchmark. And the benchmark is really to help us guide spending from a year-to-year basis, particularly to keep it under control when we have excessive revenue. And the legislature, first of all, they did not approve a constitutional amendment that I had proposed to change the way we do our budgeting, but they have followed along with our benchmark and trying to tie spending growth to these objective measures. One of the things that we've attempted to do is to create a similar kind of benchmark for healthcare and hospitals in particular in our state. And, you know, the Affordable Care Act, one of the things that it was supposed to do was to create more consumer-driven healthcare utilization, meaning consumers having some skin in the game when they made those decisions. Now, it's a little bit tricky, or a lot tricky, because, you know, as a, ordinary citizen like that, I don't really have the expertise to make those decisions. So a lot of insurance plans, most have moved towards benefit packages that require some medical professional, primary care physician, to make those recommendations upfront about what times of tests are needed and so on, as opposed to just an ordinary citizen trying to decide what they want to do. As it turns out, in states that do that and companies that do that, most private sector companies do it. It's a more efficient way, i.e. less expensive way. It's there's no doubt that healthcare is an expensive proposition. What we need to do is to kind of allow the cost to grow at the growth or the rate of economic growth, say GDP plus 1 or 2%. That would be kind of the benchmark. The problem with that, of course, is the costs are greater. Healthcare cost inflation is higher than the rest of the economy, and so you need to that extra. But if you keep doing it, if you have a payer like taxpayers that pay for Medicaid, state employees, retirees, and Medicare, then they're going to be called on to pay more as that healthcare pie grows. And so promoting better prevention, more effective utilization of healthcare is what we need to do. Very hard to do it, and very hard to do it in state government because the healthcare benefit packages are very rich and allow a lot of flexibility in terms of who decides what procedure a patient might get or not. It's very complicated, but if we don't get our arms around it, we're not going to be able to pay our retirees much in their paycheck. We're not going to be able to pay our teachers what we need to pay them, and other public employees, the state troopers and the like. And so it's a big challenge, and it's a challenge that faces every state and the federal government as the largest funder for Medicare and senior services.
Right. I think from the state of Delaware standpoint, for those who are actually following us, so your healthcare expenditure in the budget has two different big portions. One is the Medicaid part of it. The other part is you being the biggest employer of the state, your self-funded health insurance.
Right, which includes, most people don't realize, it includes the school districts, and it includes the Delaware State University, Delaware Tech, The university is, you've maybe seen in the news that they've got a big increase in their, along with us, with their healthcare expenditure. So they're looking at maybe whether they can do it less expensively on their own. I doubt that, but that's their prerogative. But yeah, because those costs, it drives up tuition at the University of Delaware. It drives up and crowds out other spending in state agencies. And so it's a big issue for all of us.
So, Governor Carney, you mentioned the spending benchmark, and how we are able to implement that in the healthcare. Is that already fully in place? Are we doing that? Like what Maryland?
It's fully in place in state government benchmark. There is no benchmark currently in healthcare. There's a proposal, legislation in the General Assembly that would do it a little bit differently than we proposed. And that has not passed either. There's a lot of very active discussion going on right now
Is
around
that
that question.
350?
Yes,
Okay.
that's a different approach. That's an approach that's utilized in the state of Vermont. And it's a tighter control than the benchmark that we had been talking about, and the benchmark that we use for state government. And so there's a lot of really important conversation going on right now about what's the best way to do that without compromising quality. It turns out that we spend a lot more money per person than other states, and yet our quality is not up there at the same level as the spending. And so we have that similar problem with, school performance, and that bothers me. And so we should work on both of those to get more bang for our buck.
So, on the healthcare side, I think when you and we discussed this, I believe last year, on one of our private meetings, I think the Maryland model, I believe, is the one that we were trying to follow now.
Yeah, we looked at that.
Mhm.
I'm sorry, I interrupted. Kemal.
Oh, go ahead.
Yeah, so we looked at that as well, and that's an option. Those hospitals basically get a global budget from a state, sophisticated state board. And so there's one hospital in our system, used to be called Nanticoke. It's now Tidal Health, which was
Yep.
purchased by the hospital in Salisbury.
Mhm.
So they're subject to that Maryland global budget. Now, that's one way to do it. It's not the way that we've chosen. It actually is, in some ways, more intrusive. We've heard these arguments about government control, which is, when you talk about government control, Medicare is the biggest healthcare program in the country. But in any case, we don't have a proposal like that on the table. Is it one that we could consider? Sure, but I think it's certainly, if the objections now are as they are, and there have been strong objections to 350, they would really object to that global budget. Now, there is a different approach which enables hospital systems, and we've had these conversations with Nemours Children's Hospital, to have a global budget and basically accept some of the risk associated with that, so that they could invest in early prevention, and other things that would save money down the road. A little bit hard to understand how the Children's Hospital would work that way, because they don't have the adults, which is where the savings would come from. I'm not an expert in it, but I know there's interest there, and that's maybe where a global budget could work, where we give a budget and say, okay, here's your budget, and manage within it. If you go over it, that's on you. If you go under it, then that, you get to keep some of that extra for other investments. Remember, none of our hospitals are for-profit hospitals. They're nonprofit hospitals. They have a healthcare mandate. And so all the extra revenue, meaning charges over costs, which goes into their fund balance, really has to go to keeping them viable financially, as well as making investments in programs that will keep Delawareans healthier.
Although they're not for profit, they're nonprofit organization, but they make a lot of profits. So
Well, they have surplus revenue or balances that accrue to what's called their fund balance. And yeah, some of them have very large fund balances, which means their charges are greater than their expenses, and others have a very tight margin in terms of revenue and expenses. And it's very different between a Christiana Care, say, and a Tidal Health or a Bay Health.
or St. Francis.
St. Francis struggles the most.
Right. So I think the one that I was probably referring to is systems like Christiana and Bay Health. Now, the problem is, there are a couple issues there. One is because they are nonprofits, but they have higher charges, higher income for similar services. They're also able to pay for certain services better, like with the doctors, with the staff, with all that. So then it puts us almost right away in a disadvantage. Those groups like mine, who is doing this a lot less expensive, but now we are actually even struggling to compete with what the environment that they are creating. So because they're able to spend the money without any responsibility in many ways, and yet they're still making profit. Now, not to mention the hospital name, but those who are watching, they can watch the other episodes and then they will know that which hospital I'm talking about. But they hired like surgeons from us. Like they just like we have an agreement for
yeah.
So they just poached a surgeon with a higher salary. And
they're the biggest player, so they have the biggest market share, and so they have power within the marketplace. They also have as a nonprofit healthcare organization, they have an obligation, and they try to fill that obligation, but they also try to maximize their market share, and that gives them power in the marketplace.
I think, John, one of the biggest maybe help that we can have is the transparency. So since they're nonprofits, so like if people are educated to make these, like use these tools, like patients, they can actually see exactly what this costs here versus there's some public tools, but
yeah, the Affordable Care Act was supposed to have incentivized just what you're talking about, which is consumer-driven decisions. And I remember several years ago when I had my hip replaced, talking to the finance guy at Christiana Care at the time and asking him, like, theoretically, what the price would be, what price would I have to pay if I was paying myself at Christiana Care for a hip replacement.
Mm-hmm.
And his answer was a little bit hard to understand at first, which was, well, we don't really have prices per se.
Mm-hmm.
We have charges. And most of those charges are plus or minus a Medicare rate. And so even in the bill that you mentioned earlier, there is a reference to reference pricing, meaning, and I think the provision said that you couldn't have more than 250% above the Medicare price for a procedure. Well, 250%, that's a big difference. On a $10,000 procedure, that's $25,000 you could, which would be in that limit if my math is right. And so it's probably like we don't have that. The bottom line is we don't have many people shopping around for where can they get, particularly and mostly in terms of state employees and retirees, they don't have to pay much of the rate. So it doesn't matter to them. They want to get the best procedure, and they should.
Mm-hmm.
So anyway, but that idea of consumer-driven, price-driven utilization really hasn't taken effect, certainly here in Delaware.
And one other thing that I want to mention this, and then maybe we can discuss these in our follow-up meetings. But one of the issue that I see is, in some cases, I feel like maybe we are not focusing on the insurance companies and the third-party administrators as much as we do focus on the facilities in some cases, because they are also setting up the cost, the charges, like because they are benefiting from that as well. So it's not just the facility who's benefiting from high charges, but because of the 85% and 15% administration portion of their total, expenses, they are willing to pay more to increase their 15% pie.
Yeah, you bring up a very important but complicated player in the middle, so to speak, and this idea of proprietary issues and costs and the information that they have and lack of transparency is a little disturbing. I don't. This is an area that I don't know a lot about, other than we are paying those intermediaries significant amounts of money to manage this system, if you will, and without a lot of transparency. And I'm not sure that I have the answer to that, other than I've always believed when the Affordable Care Act was passed, and I was in the Congress just after that, that moving towards, some consumer-driven decision-making, or at least more kind of managed care decision-making, where you kind of had, experts, people making those decisions about what kind of procedure you need or not, would be helpful in the long run. We're not there, and we're certainly not there in state government, mostly because with the arrangements that we've had, the state covers and pays for most of those costs. What I do know is it's a third of our budget, to get back to that observation that you made, over $2 billion between Medicaid, which is only half of the Medicaid spend. The other half is basically federal. We only have gap funding in terms of Medicare. So Medicare covers most of that for our seniors.
Right.
And then we cover, what's not covered for state employees and the retirees, and then active duty state employees, most of whom do have a managed care arrangement, unlike the retirees who don't have that. This is going to be this is an issue that's not going to go away. It's a big financial issue, both at every level of government and in the business sector. We used to hear more from businesses about healthcare cost effects on their bottom line. I'm sure we'll continue to hear more in the future, but they're certainly related to all of the operations of public and private agencies and companies.
I have to say this. I'm actually pleased to kind of see where we are overall. Like, we have a lot of these challenges, but when we look at the progress, and in your 2 terms, I think from the objective side of me, I can say that Delaware is a better place. So that's really important. So I think that's the message we want people out there to hear, and because we want people to stay in Delaware, we want people to invest in Delaware, and that's one of them is I'm the example of this. I was born and raised in Turkey, lived in a big city, and being in Newark initially, and then just now in Wilmington for the last 15, 16 years. It was a challenge, but I wanted to see how things are going to be. Yes, it took a little bit maybe longer, but we are here now, and this is a better place than it was before. And I do want to thank you for all those services that you have done. Just like one, if I don't ask this, I would kind of feel guilty. From the environment standpoint, I know we had in our last discussion in the YouTube, we discussed the climate change and the crisis around it. Some of them, I think you and I, we were kind of on the same page. It's just man-made, like we have seen it in Dubai. Have you seen those videos? What's happening in, like when they play with the Mother Nature. But still, we have to be kind of careful. Anything important in the budget?
We have tried to move the needle on climate change and response to climate change. First of all, the starting point is accepting the science out there that global warming is happening, that sea rise is happening, and that'll have negative effects on climate. It'll have negative effects on coastal communities, and we're already seeing it in Delaware. So the first part is, in my role with the public is to convince people that it is real, and so they'll be willing to accept it and make adjustments to life and living to try to address it and stop it in some way. And that means reducing carbon emissions into the atmosphere. There are two big places that carbon emissions come from: transportation, cars, trucks, and vans, and other things related to that, and then electricity generation. Those are the two biggies. We've made some progress on electricity generation just by converting, when I say we, the state of Delaware, by converting coal-fired generation to natural gas. Natural gas is not carbon-free. There's less carbon in it than coal-fired generation. And so we've been able to meet our targets with that transition. But now it's a harder transition to go to more renewables, offshore wind, I think we're going to have to look at small-scale nuclear. We already have a big, large-scale nuclear plant across the river and provides quite a bit of electricity. And then the second source is transportation and the movement to electric vehicles. And that hasn't moved as quickly as electricity generation. And we have just recently agreed to join a collaboration of states that will benefit from the industry's transition from gas-powered vehicles to electric-powered vehicles. By the way, if you don't convert your electricity generating system to non-carbon-based system, powering your cars with carbon-based electricity doesn't help a whole lot. And so that has to happen together. And it will be an ongoing, it's really something about the future. I feel like we've set the table in this administration for both in terms of our renewable portfolio standard on the electricity generation side, the targets there. And then on the electric vehicle sides, the legislation that passed, our commitment with offshore wind, and we have some bills that'll be in the General Assembly. So we're setting the table, and that to be followed through with the next administration and governors to come over the next number of years.
So, Governor Carney, again, I want to thank you for joining us. You have done a great job. I don't know if it's my place to say this, but I guess as someone who lives here for so long, I should be able to write. So thank you for doing what you have done. And I know you are going to be there for other services. You're not going anywhere. So I know you'll be still contributing to the state of Delaware in different capacities, but what you have done in the last 8 years was amazing. And it's important. It's important for someone who's in politics to be able to do that without getting into any of the scandals, any of the other types of rumors, where you did it so clean. From like this is not just the last 8 years. Of course, it's been a longer time than that in politics. Being able to do that is amazing, and thank you for being who you are and doing what you have done for the state of Delaware.
Well, thank you for that, and thank you for what your group does to provide healthcare services in our state. I would be remiss if not to acknowledge them in particular for their role during the pandemic. Every healthcare worker came up big. The state of Delaware came up big. And, one of the things I learned when I was serving in the Congress is that Delaware is a special place. I was a single congressperson for the whole state of Delaware, 900,000 employees, 900,000 constituents. Other districts much smaller, but we are closer as elected officials to the people that we represent than in most places. And I'm pretty sure that I couldn't do what we've done in terms of service and focus without the relationship that we're able to develop with the people of Delaware. And so I thank them for that opportunity. Hopefully, the things that we've done will really set the table for future success. That was the way we stayed focused. There's a management guru by the name of Stephen Covey who says, the main thing is to keep the main thing the main thing. And we've tried to do that, several main things, not least of which is creating an economy or cultivating an economy that creates jobs for the people of our business and of our state, and focusing on keeping our financial house in order so we can do the things that we knew, making investments today that will pay dividends in the future. So it's, we're lucky too in that we weren't so lucky with COVID, but after COVID, the economy really accelerated out of that. And we had revenue to make investments that we otherwise wouldn't have had. And that was a good thing. So thank you.
Thank you again. And we'll see you soon with other events. I know we are planning to bring you back in the next couple of months. But until then, stay safe and we'll see you soon.
Thank you, Kemal.
Bye. So we are done with our Governor Carney event. He's an amazing guy. I believe we'll see him in different capacities. We don't want to go into some of the details for his future plans. I know some of the things that he's planning to do, and I'm glad that he is. So how did you find the conversation?
No, I thought it was very insightful. Having that discussion with him as a follow-up to our other session, which I believe was February of last year. Also touching on the state address that he had in last year compared to this year. And some of the research preparation we did looking for it, just seeing some of these numbers and increases is kind of like puts a lot of things into perspective. I think a lot of people maybe don't realize that for such a small state, only population of around 1 million, the amount of money and resources that are allocated for certain projects is just really puts a lot of things in perspective, and having to manage all that, let alone successfully, and putting it to work and getting the funds in the right spots they need to be is obviously a challenge. So being able to do that year over year and effectively help the citizens at the same time is obviously important.
There's still some work to do, especially on the healthcare side. So the physician shortage is one of the big challenges for not just for us, but for the rest of the country. And also like this benchmarking issue on the spendings, it's really important. So, but I know we work with some of the state officials in the leadership of Brian Townsend, and then we'll continue working on those because we want to make sure that we are able to give them good data from the actual real business side of healthcare. And this is why it's important for us to have these conversations with our state officials, because now they hear what we are going through, what we are thinking, and then we can help them make some of those decisions. One of the really humbling things that I hear from Governor Carney was a couple of times he said he's not the expert. So when it comes to outpatient practices, we are the expert, and then someone maybe on the hospital side, and someone maybe on different fields. So bringing these expertise into the equation is kind of the way to go, so that we can actually make more meaningful impact on the policies and procedures that we have in place. So I enjoyed the conversation. I always supported him, although I should say I always supported him when he was going against Jack Markell. I was on the other camp. But out of that, there's something good came out. So he was the congressman for a couple terms. Great guy and great Delawarean, and happy to know him, and we'll see him in the future. Now, next week we have our events confirmed yet?
So next week, it's supposed to be Speaker Valerie Longhurst joining us, and then in the beginning of May, following month, we have some candidates running for the Newcastle County executive position. So we're going to be able to hear from at least 2 candidates who are running for that position. hear their thoughts, plans for their campaign.
And we are also working on Chris Coons and Tom Carper. So sometime in the summer, probably we'll bring them. This was a great session. Thank you for listening, and thank you for joining us, and we'll see you soon.
Ready? Thank you.
Bye-bye.